Assalamu alaikum. I would like to welcome you back in our Echocardiography series. This is the second episode for Read with Expert. Now look at this nice transesophageal echocardiography. This is a mid-esophageal view for chamber showing both atria and both ventricles. This is large apical VSD. Probably you have noticed that there is a large defect here, and when we put the color, there's a color crossing between the left ventricle and right ventricle. So this is a large ventricular septal defect. If you go back to this image, I intentionally put the color box over the upper part of the interventricular septum as well as interatrial septum. So what we notice here that there is small PFO with a left to right shunt. There is a trivial tricuspid valve regurgitation, but I intentionally did not put the color box over the apical ventricular septal defect just to test your ability. When you look at an echo image or echo movie clip, that you will try to get your eye on all the aspects of the heart chambers. So this is one thing you might overlooked. This is the next question. This is transthoracic echocardiography. In this view, we have a high peristendal short axis view. The question is, what's your diagnosis? And I put an arrow here in this area. This is the same patient in which you have peristendal short axis to give you more detail. PDA aneurysm. If you notice here that this is the aorta, this is the main pulmonary artery, this is the descending aorta, and usually the PDA is in between from the aortic arch to the main pulmonary artery. But here you notice that there is a large PDA, and the size of the PDA is as big as the aorta. So this is a PDA aneurysm, and it is one of the types of PDA, and it has high incidence of thrombosis, and it may cause some complications for the neonate. This is an interesting question. We have a two-color doppler jet, and I would like you to mention what are these two-color doppler jets. We have the first one is labeled as A, the second one is labeled as B. So what do you think about these two color jets? If you notice that these two color jets are, one of them is in systole and the other one in diastole. Okay, so this is the same patient. This patient has a severe aortic valve regurgitation, and there is a posterior directed jet from this aortic valve regurgitation, and it is hitting the anterior leaflet of the mitral valve. In the same time, there is significant mitral valve regurgitation. So this jet is in diastole, this jet is in systole. To make it more clarified, we have a three-chamber view. So this is the mitral valve regurgitation, which occur in systole, and this is the aortic valve regurgitation, which occur in diastole. So let's look at the previous image. So here, the color jet A is aortic valve regurgitation, and the color jet B is mitral valve regurgitation. Mention two important echo findings and what's your surgical plan. Two important echo findings. From this view here, this is apical four-chamber view in which you can see the left atrium, left ventricle, and this is the mitral valve. This is the LVOT. You can see that there is overriding of the aorta to the interventricular septum. You can see here there is subaortic membrane, and this subaortic membrane is in close relation with the aortic valve. Also, the aortic valve here is overriding the septum, and most likely there is aortic valve prolapse into a VSD, which we will see on the other view. So this is another view here. You can see that this is the aorta, and there is significant aortic valve regurgitation into the left ventricle, as well as there is a ventricular septal defect. So this patient has a ventricular septal defect and subaortic membrane. So this is the long axis view of the same patient. You notice here that there is depressed left ventricular function, dilated left ventricle. Also there is subaortic membrane, and possibly there is a ventricular septal defect here. When we have the color on top of that, there is a color into the right ventricle. So this patient has severe aortic valve regurgitation and ventricular septal defect. The procedure of choice, because this patient has aortic valve significant or severe aortic valve regurgitation, so it's not amenable for repair. The patient has a Bental procedure in which you have mechanical valve and aortic root replacement. This is the last question we have in this episode. This is 1-year-old tetralogy fellow. So this baby has a tetralogy fellow. The question is, name the important echo coronary artery finding and what type of surgical repair. So this is the aorta here. This is the right coronary artery. This is the same patient. And this is the pulmonary artery and RVOT. So what you notice here is you notice this is the aorta and this is the right coronary artery here, and there is significant important branch of the coronary artery arising from the right coronary artery and coming in front of the RVOT. So here you have significant or large branch from the right coronary artery into the RVOT. So this could be left anterior descending originating from the right coronary artery. This is the other view which make it really clear. This is the left anterior descending, and it is curving in front of the RVOT and then goes into the interventricular septum. Always we have to confirm the finding of the coronary artery by a color flow, and we can see here there is a nice color flow in the left anterior descending which originate from the right coronary artery. So this is a nice flow color into the LAD. More clarifying images. So here this is the LVOT and this is the aorta. You can see here this is the left coronary artery, and the patient is by Rastelli type of repair in which they close the VSD to the aorta, and then we put a conduit between the right ventricle and the pulmonary arteries, and we cannot do transannular patch because the left anterior descending coronary artery is crossing on top of the right ventricular outflow tract. This is the last patient in our series for today. At the end, I will leave you with this image from Saudi Arabia. Thank you.